All right, let's talk about the anatomy of the knee, and then we'll show you what a total knee replacement looks like. So here's the patella, the kneecap, front of the knee. End of your thigh bone is called the femur. The leg bone is called the tibia, okay? And I'm gonna push the kneecap out of the way. This is the interior of a knee. This is a relatively normal knee. This does not show the worn out arthritis. But the problem with arthritis is the shiny, smooth surfaces on the end of the thigh bone and the top of the leg bone wear down. My analogy for what arthritis is there's cartilage in your knee, and as you wear that cartilage cushion down, when the cartilage is gone, it's like when you wear the heel of your shoe down to the sock. That's what arthritis is, bone on bone arthritis. So I'm gonna move this aside, and now I'm gonna show you what a knee replacement would look like. We shave off a small 1 centimeter piece of the arthritis from the thigh bone. We then shave off approximately 1 centimeter of the top of the leg bone, the tibia, which is taking away the arthritis. Resurfacing the end of the thigh bone with this metal structure, often made from cobalt chrome, and then a similar metal surface that goes into the top of the leg bone. The most important component is this white plastic. This is your new cartilage or the cushion that you'll be walking on. The only thing that's not demonstrated on this model is the kneecap, which we resurface. You keep your kneecap, but we place a new smooth surface behind the kneecap. Certainly one of the best parts of my job is the patient that comes in 2, usually 4 weeks out from surgery, and their comment is, "I wish I had done this sooner." The pain they experience after surgery is nothing compared to the pain they experienced coming into surgery.